Imagine feeling the cold steel of a saw cutting through your bone while you are fully awake. No mercy, no sedation, only the strap between your teeth. Rough hands pin your shoulders and thighs. A crude saw hovers inches from a blood-slick limb. The scream gathers in your chest. Inside, the saw waits. Outside, the rain washes the blood into the mud. Crows circle. A quiet horror blankets the churned field. Here, in the fading light of dusk, the true cost of victory and defeat begins to reveal itself. The air is thick with the coppery tang of shed blood and the damp, earthy smell of rain-soaked soil, a grim perfume for the end of days. The ground tells the story. It is a canvas painted in shades of despair. Shattered shields lie half-buried in the mud, their vibrant coats of arms now obscured by filth and gore. Broken swords and splintered lances litter the landscape like fallen branches after a storm. Everywhere there are bodies. They lie in twisted heaps, their armour dented, their faces frozen in final expressions of agony or surprise. This is the harvest. A grim reaping where men, not grain, have been cut down. For most, their suffering has ended. But for a scattered few, the true ordeal is only just beginning. A low moan cuts through the gloom, then another. These are the sounds of the survivors, the unlucky ones, men with limbs shattered by mace blows, torsos pierced by arrows, or flesh laid open by the cruel arc of a broadsword. They lie trapped between life and death, their initial adrenaline giving way to a cold, creeping agony. Hope is a flickering candle in a storm. Night is falling, and with it comes the cold. The rain begins as a soft drizzle, indifferent, washing the blood from the dead and chilling the living to the bone. Into this scene of desolation, figures emerge from the misty haze. They are not knights coming to rescue the valiant, nor priests offering final rites. They move with a grim purpose, lanterns swaying through the mist. Not saviors, surgeons, craftsmen of pain. Their light catches on a wet helmet and the pale face of the wounded. These are not saviors. They are scavengers of a different sort. They are looking for the living among the dead. Their arrival does not signal salvation. It signals the beginning of a new, more intimate kind of hell. He is called a surgeon. But do not mistake him for a physician. He is not a man of learning, poring over ancient texts in a quiet university hall. He has no deep understanding of the body's intricate workings. His knowledge comes not from books, but from practice. He is a tradesman, a craftsman whose guild is that of blood and bone. He is often a barber. The same hands that shave a lord's beard and cut his hair are the same hands that will saw through a soldier's leg. He is a man of sharp tools and a strong stomach, qualities more valuable on this field than any medical theory. He does not offer words of comfort. There is no time for such pleasantries. Speed is his only virtue. The line of wounded is long, and his time is short. Each patient is a problem to be solved, a piece of broken machinery to be crudely repaired before it fails completely. He is a butcher of men, tasked with saving them. His methods are brutal. They are born of necessity and ignorance. In his world, the enemy is not some invisible germ or microscopic invader. The concept does not exist. The enemy is what he can see: the mangled limb, the protruding bone, the deeply embedded arrowhead. There is no anesthesia to grant the mercy of unconsciousness. There is only a swig of crude wine, a leather strap to bite down on, and the strong arms of assistants to hold the patient still. For the wounded soldier, seeing this man approach is a moment of profound conflict. It is a flicker of hope in an ocean of despair. This tradesman of pain is his only chance of seeing another sunrise, however slim. Yet that chance must be purchased with an ordeal of unimaginable agony. The surgeon's arrival promises a torment worse than the battle itself. The battle for the field is over. The battle for the body has just begun. Forget the clean, sterile gleam of modern surgical steel. The medieval surgeon's kit was an arsenal of iron, born of the blacksmith's fire and the carpenter's bench. These were not instruments of healing in any sense we would understand. They were tools of brute force. There was the amputation saw, its coarse teeth designed more for hacking through a tree branch than for slicing cleanly through bone. Its wooden handle was dark and slick, stained by the sweat and blood of countless prior procedures, a grim patina of past suffering. Beside the saw lay the pliers and forceps. These were heavy, crude instruments, more suited to a farrier pulling a nail from a horseshoe than to a surgeon extracting an arrowhead from a man's chest. There were probes of varying lengths, simple iron rods used to blindly explore the depths of a wound. Each probe was a blunt instrument of agony, introducing new contaminants with every exploratory plunge into the already damaged flesh. Then there were the knives. Not delicate scalpels, but short, thick-bladed knives that could have been used for skinning an animal or cutting rope just an hour before. The clatter of these instruments, as the surgeon arranged them, was a sound of pure dread. The soldier, lying on a pallet of straw, could only watch as these terrible objects were laid out. He would recognize some of them from the stable or the workshop. He knew what they were designed to do to wood, leather, and iron. Now he was about to learn what they would do to his own body. There was no comfort here, no reassurance. There was only the cold, hard reality of the iron. To understand the horror of the butcher's tools, one must understand the void in which they were used, a world entirely ignorant of germ theory. In the medieval mind, sickness and infection were caused by other forces, by an imbalance of the body's humours, by bad air or miasma, or as a punishment from God. The idea that the surgeon's own hands or his unwashed tools could be the source of the deadly fever was simply unthinkable. Therefore, cleaning the instruments was not a priority. A probe used to explore a gangrenous leg might then be used to extract an arrow from a healthy soldier, directly introducing the agents of rot deep into his flesh. This was not malpractice, it was standard practice. The environment itself was a breeding ground for infection. Every element of the procedure, from the air they breathed to the straw the patient lay upon, was saturated with pathogens. He saw the pus that formed in a wound not as a sign of a deadly infection, but as a natural and even desirable part of the healing process. It was called laudable pus. In reality, it was the battleground of a fatal infection, an infection often introduced by the surgeon himself. His tools, intended to save a life, were often the very instruments that condemned his patient to a slow, agonizing death from sepsis a few days later. They were a perfect, terrible paradox. The arrow is a deceptively simple killer. For the man struck by one, the initial impact is a sharp, violent punch. He looks down to see a feathered shaft protruding from his chest, his arm, his leg. The real danger, however, lies unseen, buried deep within his flesh. It is the arrowhead. These were not simple pointed tips. They were often barbed, designed with cruel ingenuity. The barbs were wings of iron, engineered to catch on muscle, sinew, bone. Pulling a barbed arrow back out was impossible. The barbs would hook into the surrounding tissue, tearing a ragged, catastrophic path. The surgeon, faced with this problem, had only two brutal solutions: The first was to cut the arrow out. This meant taking a knife and slicing into the already traumatized flesh, following the shaft down to the head. He would cut and probe until he could finally grasp the metal point with a pair of pliers and wrench it free, bringing with it a mangled mess of tissue. The second option was even more horrific. If the arrow had passed deep into a limb, the surgeon might decide it was easier to push it all the way through. Then, with a sharp blow from a mallet, he would drive the entire arrowhead out through the other side of the body. This created a second gaping exit wound, doubling the trauma and the risk of infection. For the soldier, both choices were a nightmare. He was fully conscious. Now he had to endure a second, deliberate violation. The arrow, which had delivered a swift wound in the heat of battle, now promised a slow, methodical torture on the surgeon's bloody table. Once the wound was explored, it had to be closed. The surgeon used a large, curved needle and a thick thread. It was the same kind of coarse, heavy thread one might use to repair a leather saddle or stitch a burlap sack closed. The needle and thread were never sterile. The surgeon might pull the thread from a spool that had been sitting on the dirty floor. He punched the thick needle through the skin and muscle, pulling the edges of the gaping wound together with brute force. The result looked less like a healed incision and more like a seam on a piece of rough clothing. These stitches trapped bacteria and debris inside the wound, creating a perfect oxygen-deprived environment for infection to flourish. The soldier, his flesh crudely sewn together with dirty thread, was left with a wound that was now a sealed incubator for gangrene and sepsis. His ordeal on the table was over, but his race against the invisible killer had just begun. Sometimes the wound is too great. A leg is shattered by a mace. The surgeon takes one look and knows no hope. The most horrific choice becomes the only choice. The limb must come off, the point of no return. He is given a large swig of rough wine, a thick leather strap forced between his teeth, held down by several strong assistants. He takes a heavy knife. He makes one deep, circular cut, through the skin, fat, muscle, right down to the bone. He takes up the saw. He places its teeth against white, glistening bone. The sound will haunt nightmares. The saw moves back and forth in a grating, rhythmic shriek. A wet, crunching sound, iron teeth biting living bone. The patient becomes a vessel of pure, screaming agony. His body writhes. Assistants hold him down. Finally, a sickening crack as the last sliver of bone yields. The severed limb falls with a wet thud. In its place, a gaping, circular wound, a fountain of blood threatening to drain life in seconds. The bleeding must be stopped. Immediately. The surgeon has one final terrible tool for this purpose: fire. Resting in those coals is a cauterizing iron. He pulls it from the fire. It glows a terrifying bright red. It hisses as it meets the damp air. He presses the red-hot iron onto the open stump. A violent sizzle, like water on a forge. A plume of acrid smoke erupts from the wound. The patient's body arches in a convulsive spasm of agony. This is pain beyond comprehension. Many men did not survive. Their hearts gave out from shock. The intense heat sears flesh and blood vessels, creating a crude, blackened seal. It is brutal but effective. The result was a blackened, charred and smoking stump. This ghastly wound is the price of survival. The surgery is over. But for the soldier who survived the table, the ordeal has merely changed its form. He has traded the sharp, explosive agony of the knife for a new, creeping horror. In the hours and days that follow, a new enemy makes its presence known. It is the invisible killer, infection. The first sign is the fever. The wound itself becomes foul. The edges swell and turn a dark, angry red, then purple, then black. Putrid fluid leaks from under the bandage. This is gangrene, flesh rotting while he is still alive. The soldier is consumed from the inside out. He descends into delirium. He might call out for water, for his mother, for a priest. This is the grim reality for most who survived the surgeon's table. They did not die from the blade or the fire. They died days later, slowly and in agony, from an enemy that had no name. They died from the cure itself. What determined who lived and who died? It was not the skill of the surgeon. It was not the strength of the soldier. Survival was pure dumb luck. For every 100 men under the knife, perhaps 5 would walk away. Scarred, crippled, haunted, but alive. The final scene is not heroic. It is quiet and lonely. A shallow grave dug in cold, hard earth. No ceremony, no fanfare, just another casualty after the battle. This was the fate of most who entered the surgeon's tent. Their hope met a slow, feverish death and an unmarked grave far from home. When we look back at the medieval world, at its grand castles, at its epic battles, remember this dark corner. Remember the terror of the surgeon's tent. It stands as a brutal testament to courage and a chilling reminder of a world without science. The greatest struggles are not always on the battlefield, but on a bloody table against the well-intentioned ignorance of the man trying to save you.